Okay, I'm going to go ahead and get started. Again, my name is David Chase. I'm the Senior Territory Manager for Neurolens. My area is the South Jersey, Delaware, and Maryland area. We have representation throughout the country and Canada, so please make sure that if you have questions after this, that you reach out to one of your territory managers that you have locally. Neurolens, and I'm sure many of you have heard of Neurolens in the sense that it's a contoured prism, and which is very different than the standard prism. I show this slide a lot of times because many of you are experiencing things like this, or you have patients every single day that are doing this, looking at phones, looking at a computer and an iPad at the same time. I was just talking with a patient earlier, and they were talking about how they always take off their glasses and rub their eyes. Or it could be the two kids looking at an iPad at the same time, or even the whole family in the same room, looking at their phones. We see that every day, and the thing is, if we don't ask about if they're doing that or what their symptoms are, then we won't find that out. Only 1 in 10 patients ever tell you about the symptoms that they have. And so one of the things that we've done to try to make it easier for you and the practice is to be able to identify those needs. And we give you 7 questions to be able to do that. We've even been able to use technology now to be able to help you talk to your patients about it. And we use a QR code now for the patients to be able to answer those questions for you. Then we have the NMD2. This is the measuring device. And I'll go into a little bit more detail about that. And then the last part is in the exam lane that you can feel confident and know that when you use Neurolens in the contoured prism, it gives you more base in prism at near where it's needed the most. Then you have that ability and you will find something extremely effective for your patients. The NMD2, like I said, it's the measuring device and it's very accurate. It will measure down to the 100th prism diopter for you. It will measure about 10,000 data points during the 2 minute, minute and a half to 2 minute measuring time. It's small, practice friendly for you, so it doesn't take a lot of space in your pre-test room. It's fast, as I mentioned, it's under 2 minutes, and it's a very interactive experience for your patient, so that it will measure exactly what that patient is experiencing in terms of misalignment, and it's very objective for you. What I'm going to do now is show a video, and this is the video of what the patient does and what they see, but also what the device is measuring for you, so that you know what the patient is experiencing.
When a patient first looks in the device, they will notice the word Neurolens at the back. Have the patient focus on the O in the center so the technicians can touch the pupils on the graphic display and the system can properly track the pupils. Next, your patient will focus on the yellow propeller on the back of the moving submarine. This is keeping the patient's eyes stable so that the device can measure the PD to the 1/10 of a millimeter. As the fish are appearing, the device is measuring base alignment under fused conditions. This is where your eyes need to be. Next, the 6 circles appear. At this point, the device is measuring the disassociated phoria. Each eye is seeing something different, but the brain is combining them to be one picture. The device is measuring how much eye movement is present. Even though the target is stationary, the patient will perceive that the target is fluidly moving from side to side. The patient should always be looking at the target. For fine alignment measurements, the patient is fused at their phoric posture with the moving peripheral stimulus. A central target is presented to one eye at a time, and the system measures any eye movement. If eye movement is detected, the system will automatically adjust the target position to neutralize the eye movement. This test is most similar to a fixation disparity and associated phoria measurement. At the end of distance testing, the screen will go completely black for 2 seconds. The cameras are realigning to test the near accommodative and vergence system. When the target is in both eyes between the fish, NMD2 is measuring the PD at near to assure the graphics properly simulate a 50 centimeter distance. After the PD is confirmed, the near testing mimics the distance testing for base alignment and fine alignment. Finally, the screen returns to the Neurolens logo and the test is complete. The technician will press the accept button and all the information gathered will transfer to the Neurolens portal, where the doctor can access the information and share with the patient in the exam lane.
So I think that's really a nice video to show you exactly what occurs as well as what the patient's observing. And I think one of the interesting parts, and I'd mentioned that in the video, that the patient appears to feel the yellow target with the 6 circles moving. And that's a good speaking moment with your patients when you're able to say to them, did that yellow target move with the 6 circles? And they will tell you, yes, it did. And you have the ability to say to them, that's not moving. That's actually your eyes moving. And so it also leads a little bit of credibility in terms of what you're saying in terms of eye misalignment. You will then get a report in your exam lane. And this information on here is the PD, the heterophorias, the ACA ratio. It also will give you the alignment of the binocular peripheral and central fusion and your fixation disparity. You will also notice that there is a vertical measurement on this as well. And it's, very accurate for that as well. But you'll also see at the bottom the Neurolens value. And that is the value that you'll use on the prescription. So when you have a patient who comes at 1.4 base N, we recommend you use 1.4 base N for that patient. Not anything higher, not anything lower. Just stick to what the Neurolens value. We've measured and we've prescribed Neurolens to over 100,000 patients. So we have the algorithm, and the efficacy built in to know that it's going to be extremely accurate. This is what you'll be able to show the patient. It was a little bit different than what it was in the video. This is actually the newest version of what we have. We've done this because it's a patient-friendly image. It allows you to be able to show the patient on a computer, which is very lifelike in terms of what we're doing nowadays in terms of near activity. But you can see the red line is where the natural resting position is for the patient. And then you have the green line. That's where they should be. So it allows you to be able to speak to the patient and say, this is where your eyes are. This is where they need to be. And the work from where your eyes are to where they need to be is what's causing the symptoms. And you can say to the left, your headaches, your dry eye symptoms, motion sickness. You have the ability now to relate to that patient where their eyes are and where they should be and those symptoms, because it's important for you to be able to say, we now have the ability to address those symptoms and reduce or eliminate those, the severity of those. Now, some of you might ask about efficacy and results. Right now, this slide says 93%, but some of our feedback that we've just gotten in the last few weeks is closer to 95% of patients who are having positive responses to Neurolens, which is outstanding. We also offer a 100% risk-free to the patients. And what that means is we will offer 100% back to the practice, and then you can manage that with the patient on how you want to refund the patient in terms of a full refund or towards another product in the office. Right now, that risk-free patients actually returning is 4%. But it's only about percent and a half of actually patients who try the Neurolens for 30 days are actually returning the product, just 1.5%. So we don't get many returns because it works for so many patients. That other couple percent is buyer's remorse, and we all see that once in a while.